Well, before our segment, you mentioned that you encourage your male patients to bring their significant others to their appointments. Why is that?
Well, Tal, you know, we men, we're not the best historians. And in a lot of cases, I'll have a male patient to come in for his follow-up visit or his annual physical. I'll ask all the questions and he'll say, I'm fine, everything's great. But we men, we just don't want to let the doctor know what's going on. Very prideful. And the bottom line is, I had a scenario recently like that, and the man just looked a little bit uneasy. Now, his wife, she was a patient in our clinic, and I knew her, and I asked him, I said, can I just call your wife and put her on the speakerphone? And he agreed. He was reluctant. But when she got on the phone, as I suspected, she gave me a lot of symptoms that he didn't tell me anything about, including blood in his stool. And when asked, he said, well, I didn't think it was a big deal. But that led me to order a lot of additional tests. He could possibly, as I told him before he left with his wife, he could have colon cancer. So this was so good that we were able to get that information and we were able to provide the better care. So all men, consider taking your wife with you to the doctor if you have a wife or a friend, because we want to know everything that's going on so we can help you.
That's a good idea, but maybe some people are just not able to because of work or things like that. So what are some specific examples or benefits of bringing someone with you if they can come?
Well, basically some of the benefits. I mean, as a doctor, we give you your diagnosis. Sometimes it might be overwhelming. For instance, I told a patient 3 days ago, your thyroid levels were elevated, out of control. And I started explaining and I looked at her and she had that look in her eyes. She was just gone. She didn't hear anything I said. But having that extra person, they could take notes and be your extra ears, and they may not be so overwhelmed. They can receive the information. Also, it's a good idea if you can find somebody with a medical background, because that person could better understand the doctor and ask the right questions. And then when you get home, they can follow up and make sure you understood. But the take home is just having that extra set of ears. Hey, you can't replace it.
Yeah, can't go wrong with that. What if you don't have someone you can bring to the doctor? Can you bring maybe a pet? Or what are your suggestions?
Well, I wouldn't bring your pet, but let me just give you some ways that you can help if you can't find that person. Now, one thing that I do is I encourage my patients, if they want to, they can record the visit. Turn your iPhone on and just listen to it. Or you could even take notes before you get there and go through your list. Say, Doc, number one, this is my question. Number two, that way you won't forget anything. And lastly, I'm okay with patients, calling someone and letting them listen in. I have family members all over the country. When they go see their doctor, they call me on the speakerphone, and it's me and the doctor in California and Texas. And I can talk to the doctor on behalf of my family member, but you have to get the doctor's permission first. But at the end of the day, the more information we get as medical doctors, the better we can help you, and you can get the best medical outcome.
Absolutely. And as you always say, get checked early. Thanks so much, Dr. Quinn. Really appreciate your time.